I've made it clear, I think that Secretary Kennedy is dead set on making it harder for children to get vaccines and that kids are going to die because of it. And Mr. Chairman, I'd like to put in the record today an op-ed written by Susan Monarez, who was fired by Mr. Kennedy.
Without objection.
So what we know, and Dr. Monarez, was approved by Republicans. She wrote an op-ed today in the Wall Street Journal, which I've just put in the record, and I quote her. She said, "I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric." So this is not some liberal philosopher or something. This is the CDC director who tells the Wall Street Journal, which is not exactly interested in progressive, theories and the like, that she was told to pre-approve the recommendations of a vaccine advisory panel filled with people who've publicly expressed anti-vaccine rhetoric. So my first question, Mr. Secretary, is did you, in fact, do what Director Monarez said you did, which is tell her to just go along with vaccine recommendations, even if she didn't think such recommendations aligned with scientific evidence? That is
no, I did not.
That's a yes or no. So you have an opportunity to call her a liar if you say that you didn't do it, but I'd like to see you respond to this.
No, I did not say that to her. And I never had a private meeting with her. So there are witnesses to every meeting that we have, and all of those witnesses will say, I never said that.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir.
Okay. Let's talk now about what's coming up, because I've made it clear what I've thought about the 203 days with my colleague, Senator Also Brooks. In 2 weeks, CDC's Advisory Committee on Immunization Practices will meet to make decisions about critical vaccines that protect us against hepatitis B, measles, and more. The committee's got a profound impact on vaccine access, but these aren't ordinary meetings. You've stacked the deck to ensure the panel bends to your views. In June, you fired all 17 committee members who are respected scientists and doctors. You replaced them with non-experts, vaccine skeptics, and conspiracy theorists. As a result, this critical advisory panel has lost scientific credibility. After years, colleagues, we spend so much time not looking at this as Democrats and Republicans, but as good science and scientific credibility. And now the American Academy of Pediatrics has warned that the committee is being politicized at the expense of children's health. American Academy of Pediatrics, you think they're lying too?
I think the American Academy of Pediatrics is gravely conflicted. They get their biggest contributors are the 4 largest vaccine makers. They run a journal, Pediatrics, which they make a lot of money on, that is completely dependent on pharmaceutical companies. So I wouldn't put a big stake in what they say that benefits pharmaceutical interests. Senator, I didn't politicize ACIP. I depoliticized it. The Congress has been investigating ACIP.
All over the country, Mr. Secretary, scientists and doctors are saying otherwise. They're all wrong, too. They're all lying, according to you.
The scientists and doctors are supporting me all over the country. There is division on opinion.
I don't get letters from thousands of people who are not political saying that this set of changes is going to damage American health care, and particularly these health care agencies, for decades to come. I don't get any letters from people saying, hey, this is going to make a big difference forever.
Maybe you're listening to a selective group of people.
Well, you get me.
Yeah, and I will.
Fine.
I will tell you what, Senator. I will put my mailbag against your mailbag any day of the week.
I got 30 seconds. Dangerous respiratory viruses like RSV are on the agenda for the next advisory meeting. Countless parents have been awakened in the dead of night by a wheezing kid gasping for air, forced to rush their little one to the ER. There's no worse heart-wrenching fear. The RSV vaccine offers these kids protection against the worst effects of the virus. But now it looks like you're on a crusade to make infants and babies more vulnerable to the terrible illness. That's what we're doing with the COVID changes.
And please make your answer brief, Mr. Secretary.
I've said that
The position is indefensible. I think it's possible.
Congress has been investigating that committee for 23 years because it is pervaded with conflicts of interest. What we did is we got rid of the conflicts of interest and we depoliticized it and put great scientists on it from a very diverse group. Let me close with very pro-vaccine.
Let me close with this because, like Senator Crapo, I'm a few seconds over. I don't think, Mr. Secretary, this is about you and me. This is about kids being pushed in harm's way by reckless and repeated decisions to get scientists and doctors out of the way and allow conspiracy theories to dictate this country's health policy. I don't see any evidence that you have any regrets about anything you've done or plans to change it. And my last comment is, I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense. Thank you, Mr. Chairman.
Do I get a reply? Or Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening? Today, for the first time in 20 years, we learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
I'm going to let Senator Wyden respond briefly to that, and then we're not going to go over like we just did.
Defend this committee on a bipartisan basis. Colleagues, my cabinet secretary says that we have no interest in chronic care. Mr. Secretary,
Mr. Chairman, could we have regular order, please?
We are in the process of turning around the Medicare program with the chronic care bill that Chairman Hatch, when he was chairman in this committee, put together on a bipartisan basis.
All right, we're going to proceed. And I just want the rest of the members to know, I gave Senator Wyden as ranking member some leeway there, but we're going to stick to the 5 minutes.
Mr. Secretary, in June, you fired every member. Mr. Secretary, Mr. Secretary, may I have my time back, Mr. Chairman? Thank you. Mr. Secretary, thank you for your attention. In June, you fired every member of the well-qualified panel that was charged with recommending vaccines to the CDC. No one in your job has ever fired every committee member all at once. That month, you told the American people that you were, quote, going to bring great people onto the ACIP panel, not anti-vaxxers. Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the inventors. As I said, Dr. Malone is one of the inventors of the mRNA vaccine, so he knows a lot more about it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made, just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it? It's not true. It wasn't true when he said it, and it's not true when you said it. Secretary Kennedy, later this month, your new panel will meet to consider changing vaccine recommendations for American children. In addition to the COVID-19 vaccines, they are set to review recommendations for the hepatitis B vaccine, for measles, for mumps, for rubella and varicella vaccine, and the RSV vaccine. These are common back-to-school vaccinations for children all over the industrialized world. If you change that, You owe parents in Colorado and across the country the benefit of some transparency, I think. If your panel recommends changing the vaccine schedule for children, do you anticipate that fewer children will receive these common vaccinations, yes or no?
What I would say, Senator,
The obvious answer is yes. Should parents and schools of Colorado be prepared for more measles outbreaks as a result of that, Mr. Secretary?
Senator,
how about more mumps outbreaks?
I do not anticipate a change in the MMR vaccine. ACIP is an independent panel. So
well, it's a panel. You just put those folks on. Far from what you said, they're people with ideas that are completely outside the mainstream.
You mean out of the pharmaceutical paradigm?
Let me just say, Mr. Secretary, all these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
I think that parents should be free to...
I know you said that before. I do too.
To make their own choices.
So will they be just as free after these?
I assume they will be.
I will hold you to that, Secretary Kennedy, because this is not a podcast. It is the American people's health that's on the line here. This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology. I think it's critical for you to share the evidence that this panel will rely on. Will you give the American people 6 months or 6 weeks in advance the record that they're going to rely on to make these decisions? Will you make it transparent for the American people?
All the evidence is transparent.
Will you make it in advance transparent for the American people so they can comment on it?
All the evidence is transparent for the first time in history, and you were never there complaining when the pharmaceutical companies were picking those people and then running their products through with no safety testing.
You can characterize it any way you want. I quoted them today. What I said was accurate. What you said were lies. You described people
Senator,
moving the Titanic. Senator,
are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply...
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire...
You're evading the question.
No, I'm asking the questions here,
You're
Mr.
evading
Kennedy.
that question.
I'm asking the questions, Mr.
I asked
Kennedy.
you a question.
I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
And I'm approaching this as a doctor, not as a senator. I am concerned about children's health, seniors' health, all of our health. And I applaud you for joining the president in a call for radical transparency. Thank you for that. I said yesterday, I believe it, that President Trump deserves a Nobel Prize for Operation Warp Speed. If he had been President Obama, he would have gotten it. But because of Operation Warp Speed, forcing the federal government to come to a vaccine development within 10 months when others said it couldn't be done, we saved millions of lives globally, trillions of dollars, we reopened economies, an incredible accomplishment. Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
So let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also were
Senator, I just want to make clear, I did not say that.
We'll check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access. Now, let me ask.
I'm happy to explain why.
I had 3 minutes and 30 seconds left. It also surprises me because you've canceled, or HHS did, but apparently under your direction, $500 million in contracts using the mRNA vaccine platform that was critical to Operation Warp Speed. Again, an accomplishment that I think President Trump should get a Nobel Prize for. You canceled $500 million in contracts. Now, I grew up in a middle-class family, so $500 million seems, just to cancel, it seems like an incredible waste of money. But it also seems like a commentary upon what the president was attempting, what the president did in Operation Warp Speed, which is to create a platform by which to create vaccines. So this just seems inconsistent that you would agree with me the president deserves a tremendous amount of credit for this.
Is this a question, Senator Cassidy, or is this a speech that you don't want me to answer? Because I want to answer that question.
Please,
if it's a question.
But be tight, please.
First of all, the reason that Operation Warp Speed was genius is it did something nobody had ever been done. I don't think any president but President Trump could do it. It got the vaccine to market that was perfectly matched to the virus at that time when it was badly needed, because there was low natural immunity and there were people getting very badly injured by COVID. And then, but it was also brought in therapeutics like hydroxychloroquine and ivermectin and protocols for treatments. And there were no mandates. And then
okay, I have another question, so please, about 15
That's when I began litigating against President Biden's mandates. Now,
I'm sorry, let me go on because
in terms
you've
of
covered
me
the mandates
canceling
before.
those contracts.
I have limited time, Mr. Secretary, I'm sorry. You've called for, and rightly so, that we should restrict participation in agencies for those with conflict of interest. I would like to submit for the record a evaluation of the conflict of interest of those who are on the ACIP and the Vaccines and Related Biologic Products Advisory Board. It was not 97% as alleged, rather it was 6.9%, and it was 1.2%, I think, for the other panel.
Without objection.
Now, I am concerned, though, because many of those whom you have nominated for the ACIP board,
Senator,
excuse me, can I have my time back?
Yes.
Yeah. What I am concerned about is that many of those whom you've nominated for ACIP have received revenue as serving as expert witnesses for plaintiffs' attorneys suing vaccine makers. Now, one of my colleagues in another setting alleged that you seem more interested in settlements than science. If we put people who are paid witnesses for people suing vaccines, that actually seems like a conflict of interest. Real quickly, do you agree with that?
No, I don't. It may be a bias, and that bias, if disclosed, is okay. But it's not a financial. It's not a financial conflict. It's not a financial conflict of interest.
Let me finish up. You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. And as I conclude, I would like to say this. Because of the conflicting recommendations made about COVID, this is from Eric Erickson, good conservative out of Atlanta, Georgia, occasionally gives me hell. My wife has stage 4 lung cancer. She is one of the people the COVID vaccine actually helps. Thanks to the current mess at HHS, CVS is unable to get her vaccine. Secondly, an email from a physician friend of mine. Hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. We are having our attorney try and render an opinion, but there's no firm guidance and concern about liability if vaccines are given to a patient who requests it but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
You know, I represent one of the most science-based states in the country. That is percentage of scientists per capita. And at your confirmation hearing, we asked about this, whether you would follow science. You've made a statement here today in your testimony that you would follow science, and yet you're not following science, and that's what Senator Cassidy's question was. It's a simple yes or no answer. Do you think the president deserves to get a prize for warp speed in the mRNA technology that saved so many lives, and you won't answer that question.
I answered it.
No, you're saying that there are problems with what was interpreted. You could say yes. Do you say yes?
I said the
right
president deserves a Nobel Prize, but our mRNA vaccines that we're working on, the ones that we canceled, which are for upper respiratory infections alone,
You
are those...
canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. The history on vaccines is very clear. This is the 20th century. That's how many people had vaccines and had illnesses. This is the 21st century. This is the decrease, 99% down to 100%. This is what was delivered with vaccines, and you don't want to support that. You don't want to support that evidence. So yes, the governors of the West, Washington, Oregon, and California, will take up the efficacy of science. Yes, the University of Washington will deliver the science that America will depend on, because you don't want to depend on it. And his own Surgeon General of the Trump administration said over 2 million lives were saved because the mRNA technology, and you don't want to continue that. You don't want to continue that technology. So what country is going to now take up that technology lead? What country is going to do that? Leaving us more vulnerable to some other country, keeping the advantage on having the best technology. So I'm telling you, I represent a state that's about technology. I have two other quick questions for you.
These questions or statements? Because I can answer that question if it's actually a question.
Do you believe in having the ACA and the support for the ACA that is about to expire? Do you believe in doing something about that?
In terms of the enhanced premium tax credits?
Yes.
Well, the Democrats had two chances to make them permanent, and they didn't. And they didn't for a reason.
We're the ones who delivered it. So I'm just asking yes or no, do you want to do something about this? Yes or no?
I want to fix the system, and that's what we're doing, fixing systematically to make premiums lower. That's what President Trump wants to do.
Do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol
The women
yesterday.
who were talking about Epstein, do you think they were a hoax yesterday?
Do I think they were?
Do you think they were perpetrating a hoax yesterday?
Perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first I'm hearing about it.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public? That's the first you're hearing about it? What I'm saying is you are perpetrating hoaxes. You, as this Secretary of Health, so you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease. But you're not putting solutions on the table to cover more Americans, and you're taking away the science and technology that has made us the leader that has saved, according to the first Trump administration Surgeon General, millions of lives, and you don't want to keep that going. So no, I don't support your continued efforts as Secretary, and I definitely think that our colleagues need to rally around science. If you want the Northwest to continue to lead on all innovation and all healthy people, okay, we'll do that. But it's a sad statement for the rest of America and America's leadership on technology. Thank you, Mr. Chairman.
I actually had hoped. I didn't support you. I thought taking on chronic illnesses was going to be important. I've got 2 kids, as we discussed when we met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this, that seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because the There was so much data chaos coming out of CDC, and there were so many perverse incentives. And these are model
You don't know the
studies.
answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved
and
lives?
that's the problem, is that they didn't have the data. The data by the Biden administration absolutely dismal.
So who is politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
They fired Dr.
Go
Krause.
to the Trump Surgeon General.
They fired Dr. Krause. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Krause.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you've got to one. I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there was not a single study that does not, and I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing health care policy, not being the doctor in residence for all of America. I hope I can just say, hey, I'm still going to trust my doctor rather than your health advice. And obviously, Tom Cotton's going to, who knows who he's going to trust. But let me go back to policy for a couple, so maybe we can lower the temperature a little bit. I got a bipartisan bill that would be a systemic fix, not a vote-buying mechanism when Medicaid's getting cut, what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Would you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%. So there is actually ability to get rural providers.
President Trump supports that, and we support.
Do you support? You support. Good. So you will work with us to get that passed.
Yes.
That will increase costs on both Medicaid and Medicare, so you are committed to that. I appreciate that. What about Senator Wyden and I've got a bill, because across America,
what about what?
Hospitals are shutting down on their OBGYN services. Try to have a baby. I don't know about all of my other friend states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OBGYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services, who has said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue that OBGYN doctors are fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come with me to a community health center in Virginia and hear what is on people's mind. They want to get healthier? Absolutely. Count me in. But they also don't want their basic health care removed. Thank you, Mr. Chairman.
Now, I want to follow up on a line of questioning that Senator Cassidy began. Mr. Secretary, President Trump said that the COVID-19 vaccine produced by Operation Warp Speed was, and these are the president's words, a monumental national achievement. Although I have strongly opposed many of President Trump's actions, I agree with him that Operation Warp Speed in 2020 was a monumental achievement. Unfortunately, you are undermining one of the president's biggest achievements, which, as the president said, saved millions of American lives. You even went as far as to call President Trump weak for this life-saving accomplishment. Last year, you tweeted that President Trump has a weakness for swamp creatures and that Operation Warp Speed was among, here's your quote again, the most devastating impact of President Trump's weakness. So, Mr. Secretary, was Operation Warp Speed a monumental national achievement, as President Trump said?
For the reason that I already said, and I assume you won't let me repeat, but I'm happy to if you want, yes, it was.
Good. Assuming it is a monumental achievement, you've said it was, is it true that, as President Trump has said, he saved millions of American lives with the COVID-19 vaccine? Because you've just expressed great confusion about that to Senator Warner.
The only confusion I expressed is exactly how many lives were saved. I don't think anybody knows that because of the data chaos.
So multiple studies have shown that the vaccine reduced infections and severe diseases and saved at least 3 million lives in the United States and millions more abroad in the first 2 years of the pandemic.
It's possible those are modeling studies.
I will also note, just as you've been talking about data and your concern about it, the process for COVID vaccine approval was public, it was live streamed, and it was out in the open. Manufacturers and experts have publicly submitted data analysis, and when the FDA has asked for more, they've submitted more. They've done that for years, and the evidence is clear and supports what President Trump has said. The vaccine works, and it has saved millions of lives. Your own process, on the other hand, has not been transparent. You repeatedly choose to ignore data because it doesn't match your preconceived notions and lies. So you have said that the vaccine did save lives. You've said it was a monumental achievement. And given that, if you agree with President Trump that the vaccine saved millions of lives, why have you acted behind closed doors to overrule scientists and limit the freedom of parents to choose the COVID vaccine for their children? Why have you done that?
For the COVID vaccine, I was removed by FDA because they were the industry.
No, it was behind closed doors.
No, it's not
and scientists who said they wanted to brief you on the science, scientists who wanted to understand why the FDA, why you unilaterally changed the parameters for giving vaccines, making it possible now, to Senator Cassidy's colleagues' points, that they're going to have to go off-label.
This is crazy talk. You're just making stuff up.
To prescribe a vaccine for children. I'm not making things up. Do you know how the FDA approval process works and what happens?
Yeah, I know exactly.
Do you know what an off-label prescription is?
I know exactly how it works. I know exactly how it works.
So why behind closed doors?
It's not behind closed doors. The industry makes the studies, and they could not provide a study that said that it is effective for healthy kids.
So when have you produced the data that you relied on and that this FDA relied on to change those parameters? You did it behind closed doors.
No, the data is all public.
Now parents who decide that they do want their children to have
You're just
COVID
making
vaccine
stuff up, Senator.
I'm not
You're
making
just
stuff up.
making stuff up.
You know, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy. So let's just settle with this. So here's what's going to happen. To Senator Warner's point, to the parents who are concerned all around the country, to people who want to get the COVID vaccine this fall, even if they're under 65, because the boosters have worked, there's been much less serious disease, people do not have the same level of threat and risk from COVID that they used to because of these vaccines. People who want to exercise their freedom of choice are being denied that.
No, they aren't. Everybody can get the vaccine.
Because you are citing data that you won't produce to the public.
You're just
and
making
you
things
are
up.
rejecting
You're
science.
making things up to scare people, and it's a lie.
With respect, I do not think I'm the one making things
You
up.
are
Thank you,
lying
Mr. Chair.
right now, Senator.
So last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, If vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy free.
The question is everyone who wants it. That was your promise, Mr. Kennedy,
I never
mine.
promised that I was going to recommend products with which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
it depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were witnesses.
Let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because
you.
I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
Just want to pick up on Senator Warren's point. Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no.
Wow.
Giving a quote. And I asked her twice.
No, 1 second. And you're also repeating now that she is a liar, correct? What you wrote in the Wall Street Journal.
If she wrote that I fired her because she refused to sign on in advance for the ACIP committee, no, that's not accurate.
All right, so you're calling her a liar, and I look forward to her coming before the Help Committee, maybe this committee as well. All right, Mr. Secretary, I've got a bunch of questions. Appreciate brevity in answering it. So-called big, beautiful bill threw 15 million Americans off of health care, substantially raised premiums, and is going to have a terrible impact on nursing homes, community health centers, rural hospitals all over America. Very briefly, is that really making America healthy again?
It's going to have it's going to be the biggest infusion of federal dollars into rural health care in American history.
Yeah, you know why? Because you're cutting $150 billion for rural hospitals. You're putting $50 billion back. That's not an infusion. That's a loss of $100 billion. All right, next question. President Trump, who I don't usually agree with, called COVID vaccines, quote, one of the greatest miracles in the history of modern-day medicine that saved tens of millions of lives worldwide. Scientific community agrees with Trump. Lancet study found that it prevented almost 20 million deaths during their first year of use. Secretary Kennedy, are President Trump and the medical community right, or do you still believe that the COVID vaccine was, quote, the deadliest vaccine ever made?
No, first of all, I didn't say that. Oh, I said that in terms of affairs reports a while ago. I said today, I think that President Trump should get the Nobel Prize.
So who's right? Is Trump in the medical community right, or are you right?
President Trump did an extraordinary piece of leadership.
Is he right or wrong? Did COVID save millions of lives?
As I said, he got Americans back to work. At that time, that particular vaccine was perfectly matched to the virus that was circulating then. And I have no idea how many lives it saved, but it saved quite a few.
You know, what I find a little bit weird in this discussion, I'm hearing it over and over again this morning, Mr. Chairman, is we've got the entire medical community on one side. You got the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association. All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are who are the organizations that are agreeing with you and casting aspersions on vaccines?
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz, Vinay Prasad.
So you got a few doctors who agree with you, and I'm giving you the
Not a few doctors. What you're talking about is there's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical industry.
So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors.
And
the American Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food
Everybody but you, Senator. But you know what? When you ran for president, we have a corrupt campaign finance system. Maybe you will agree with me on that. Okay, you were already president. You got a billionaire behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so. And I think the issue now...
I don't even know what you're talking about.
Well, I think you do know what I'm talking about.
I don't know what you're talking about.
The issue is every time anyone disagrees with you...
Are you saying the pharmaceutical industry was supporting my presidential campaign?
I'm saying...
I don't think so.
I'm not saying that. I'm saying that the pharmaceutical industry is a greedy institution which is charging us the highest prices in the world. They are pervasive. But to suggest that every institution, the AMA, the pediatrics people, is corrupt because they disagree with you is an insult to the American people.
Listen, people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya, with Marty McCary, with Dr. Oz.
You have given the names of a few people. I have given you the names of organizations representing hundreds of thousands of doctors and scientists. I yield, Mr. President.
Senator Tillis.
I can't conclude from the discussion today where you are on warp speed. So I would like the definitive statement on exactly where you are. Was it good? Was it bad? Were there things that worked? Were there things that didn't work? I can't discern that from what you said here. I, for one, think that it was a signature accomplishment of President Trump, and the mRNA platform is something.
I agree with that.
I look forward to you giving us a detailed statement on exactly where you are with warp speed. I'm not a doctor. I'm not a trial lawyer. I'm a boring management consultant. Another question that we'll submit in the record, I'll give you directionally where we're going. I don't see how you go over 4 weeks from a public health expert with unimpeachable scientific credentials, a longtime champion of MAHA values, caring and compassionate and brilliant microbiologist, and 4 weeks later, fire her because at least the public reports say because she refused to fire people that work for her. So as somebody who advised executives on hiring strategies, number one, I would suggest in the interview, you ask them if they're truthful rather than 4 weeks after we took the time of the U.S. Senate to confirm the person just for the future nominee that we're going to have to consider. But I do also believe that some of your statements seem to contradict what you said in the prior hearing. You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that, and I'm sure that you will have some. You will do nothing that makes it difficult or discourages people from taking vaccines. There seem to be several reports that would seem to refute that, but I'd rather you just respond to it. I'm not going to come here and impose my belief over any of yours. That, again, seems to be contradictory to the firing of a CDC director, the canceling of mRNA research contracts, firing advisory board members, attempting to stall NIH funding, eliminating funding for the I think $500 million for further mRNA research, and just want an answer for it. On H.R. 1, I believe you know my concerns about H.R. 1. I've had several meetings with, and H.R. 1 is the big, beautiful bill, OB3, whatever the brand is. But I'm still, I've got an office with 60 staff, including half of them in state office. I've had 3 different estimates of the economic impact on the state of North Carolina. Can I get your commitment? And I have been looking for somebody that's far more resourced than an office of 30 people up in here in D.C. to disprove my estimates with respect to the impact on North Carolina, period. And I've yet to have anybody. I would love to be embarrassed and be wrong, but I would like to get your commitment for people to tease through the numbers that I provided before the vote on H.R. 1 that says that if you normalize 3 independent estimates across a broad spectrum, $25 billion over 10 years. I don't need your response now. I want somebody to destroy my estimates because to this point, the most resourced health agency in the world has only given me word salad responses, and I need that so that we can prepare for the response. $25 billion over 10 years. is half of the Rural Relief Fund over 5 years. And so we just need to have that fact as a matter of policy so that we can go in North Carolina and absorb it. And I know every state's different, and I'm assuming every one of my colleagues here have done the math for their states, not focused on that. But I want you to destroy my estimates if they're in fact wrong, and I want you to acknowledge them if in fact they're right. That will come into question as well. Mr. Kennedy, you've stated multiple times in response to other members' questions that scientists were lying. We'll go back to the record in cases where you've said that. I'd just like to see the scientific evidence to substantiate that. I'm going to stipulate that you were honest and you had research behind it. We'll go back and figure out what scientific studies you believe are founded on lies and not scientifically viable. And then finally, I just want to give you an opportunity. Apparently in the exchange with Senator Bennett, you said you agreed with Dr. Levy's statements, who said that the mRNA vaccine caused serious harm, including death, particularly in young people. They said you agreed with that comment. Did you agree with that comment or not?
I think that's true, yes.
Okay, thank you. Thank you, Mr. Chair.
So, Mr. Kennedy, I have sat here for the last many minutes and listened carefully to your testimony. And I think actually Senator Tillis laid out so many of the ways that what you have said has contradicted yourself and others. It's, I mean, I don't even know where to start. So I'm going to start here. Over the last 8 months, you have claimed to make America healthy again. But in actual fact, you have led the charge in the Trump administration to destroy what is best in our healthcare system. And your denials and your evasion and your lies here do not change that. You are the Secretary of the Health and Human Services. Yet you're trafficking in these fringe idea and discredited theories that are completely out of step with the scientific consensus. And you seem to be willing to say anything in the moment, even if it's untrue. So last time you were before Congress, Secretary Kennedy, you claimed, and I quote, "I have never been anti-vax. I have never told the public to avoid a vaccination." But in a podcast, you said the opposite. You said there's no vaccine that is safe and effective. So that sure sounds anti-vax to me, Secretary Kennedy. So let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so more denial, more back and forth. I mean, here's what I know. Here's what I know.
You want me to explain why, Senator? You just
No,
want
actually, I want you to listen to me.
Okay, go ahead.
I want you to listen to me, because I've been listening to you. You said that ACIP is an independent panel after you stocked it with your picks. You said that you want evidence-based science, but it seems that what you mean is evidence that supports your view, not the scientific consensus. I mean, you dared to sit there and call my colleague from New Hampshire a liar when she presented you with facts that don't support your view of the world. It's incredible. But let me move on. Just last week, in the days after the tragic shooting at Annunciation Catholic School in my home state of Minnesota, you went on Fox News blaming school shootings on antidepressants. You have no evidence of that because you have no evidence of a connection. And you want to talk about...
You're just saying something. You're just making stuff up.
You know, this is what you say, right?
No,
Secretary Kennedy, when someone presents you with information that does not fit
I did not blame that shooting. I have no idea whether... I have no idea, and I never said that. You're making it up. You're twisting. Yeah, you are.
Secretary
you are being
Kennedy,
dishonest right now.
If you want to talk about mental health and gun violence in this country, if you want to talk about mental health and gun violence in this country, we should be talking about that, because that's what the parents of Annunciation School
You don't want to talk.
You want to
harangue, and you want to you want to have partisan politics. I want to actually solve these problems.
Secretary Kennedy, what the Trump administration is doing right now is making it harder for people in this country to get access to mental health care. So don't talk to me about solving the mental health care crisis when you are making it harder. You cut Medicaid, which is the #1 payer for mental health care services in this country. You decimated the agency at Health and Human Services that focuses on mental health and substance abuse. That's what states count on. They're cutting their services to schools as a result of that. Several years ago, in a bipartisan way, Congress came together and passed the Safer Communities Act, which made important investments in mental health care and did some important, though small things, to reduce access to guns. What do? You propose cutting that funding. This is what we're talking about in your leadership in the Department of Health and Human Services. If you want radical transparency, as you talk about, I mean, take a look at what you are doing. And, you know, I've heard a lot about MAHA today while we've been here. There's a lot of Americans, Secretary Kennedy, who trust you, who believe what you say, especially when you say you're standing up to corruption. And I think that they need to know, you apparently have a lot of influence with President Trump. Did you ask him not to roll back these regulations that are stopping the big corporations from dumping heavy metals and endocrine disruptors into our soil and water? I mean, there's no evidence that you have been even opposing that. Did you do anything to stop the Trump administration from rolling back this handout to Big Pharma that makes it easier for the big drug companies to charge more for cancer drugs? No, you presided over that. I mean, it's stunning, really, what's happened over the last 8 months. It's stunning to me. And I just hope that in this moment, our colleagues, there's hardly anybody left in this room, are going to think about what it is that you've done, what your legacy is going to be at the Health and Human Services Agency, and pay attention to the damage that is being done here.
Secretary Kennedy, Dr. Daskalakis, who recently resigned as director of the National Center for Immunization and Respiratory Diseases, his resignation letter stated he and his team were never allowed to brief you. I'm curious who you're listening to, since it's clear you're not listening to qualified experts like Dr. Daskalakis. Can you give the committee the name of the person?
I don't consider Dr. Daskalakis.
Mr. Secretary, the question that I have for you is, can you give the committee a name of who you're getting briefed by?
I'm getting briefed by all the time by CDC.
Just a name.
Well, Dr. William Thompson's one name.
Thank you very much, sir. Now,
but I can get you a whole list of others. It's on my schedule.
Mr. Secretary, that's not a hard question. You know a lot of answers.
I'm not being evasive.
Okay, then you answered it. Let's go on. Now, you said that you're soon going to release a study claiming to reveal the cause of autism, timed, unsurprisingly, with the upcoming ACIP meeting to justify taking vaccines from Americans. Now, as you know, autism affects millions of children, so I guess you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
He's a contractor?
He's a contractor.
Do you know who works for you, Mr. Kennedy?
Yeah.
Do you know that Mr. Geyer is listed as a HHS on the employee directory as a senior data analyst, not a contractor?
He's a contractor. He's not an SGE.
So is your website wrong?
He's not an SGE. I don't know what the...
I'm going to pull up the website for you?
He's a contractor.
If the website says he is a senior data analyst, will you at least admit to the committee
I don't know if
wrong?
a contractor can be classified as a senior data analyst or not.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board. He sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot. It's incredible, Mr. Kennedy.
Senator, you're ridiculous.
So here's the question I have. You brought him in to do this study. I think there's no question about it.
I told you he's not doing a study.
Is he participating in the study?
No.
Is he doing any analysis in regards to this study?
No. What he's doing is getting access to the Vaccine Safety Data Link, which is the biggest repository for vaccine information that your friend would not give us for 7 months. For
Mr.
7 months.
Secretary, let me ask you this question, just because you know the answer. What is Mr. Geyer doing?
He is the only one, because Congress ordered CDC to open up the VSD to him in 2002. He's the only outsider who's ever seen it. So because CDC will not give us, they have
Mr. Secretary, is he participating in this then?
No, he is.
But you just said he's the only dude that knows what's going on here.
Do you want me to explain it to you, Senator, or do you just want to show? Do you just want to showboat?
I'll submit
You
this.
just want to showboat for your ads, or do you want to hear a real answer to your question?
Mr. Secretary, you choose to know answers to questions with some colleagues. And with others
I'm
you
willing to
pretend
give you
not
the
know.
answer. I'm
Maybe
willing
someone,
to give you the
Mr.
answer.
Secretary, someone should have asked you, maybe President Trump should have asked you, are you a trustworthy person? And we should have waited for an answer then. Let's move on.
I don't even know what you're talking about. You're talking gibberish.
Mr. Secretary, let me speak slowly and clearly so that you can understand me through my New Mexico accent.
And then give me a chance to answer.
Does this help? Can you understand me?
Yes.
Appreciate that. Mr. Secretary, yes or no, did you hire Mr. Geyer to do this study?
No.
Mr. Chairman, well, let me ask, maybe we'll just get a good answer here. Mr. Secretary, will you commit to sharing the protocols used for the autism study with Congress and to the public?
They're public.
Will you commit to giving it to this committee by the end of the week?
No, not because
that's
not the way it works.
Will you
don't even know what you're talking about.
Mr. Secretary, will you commit to sharing the protocols for this study by the end of the month?
We already have
You
put
just said
out,
it's public.
we put out the notice of funding opportunities, and then the scientists from all over the world.
You're not understanding me. Let me speak
No,
clearly
you're not
again.
understanding how the world works.
Do you understand what the protocols
Senator,
are? Do you understand what they are?
The scientists who are doing the studies submit the protocol.
Okay, so you know
That's
what
not
they
coming
are.
from
Okay,
us.
so will you commit to sharing those protocols with this committee?
Well, anybody can get a hold of the protocol. It's published with the study.
Mr. Chairman, what I'd like to ask is for your commitment here. I'll send a letter to the Secretary. I'll ask for support from the leadership of this committee to ask for those protocols. If those protocols are not given to this
Anybody
committee,
can get the protocols.
Mr. Secretary, I'm not talking to you. Mr. Chairman, what I'm asking...
If the protocols are public, we can work with you to...
What I'm asking, Mr. Chairman, is that if those protocols are not given to this committee, I'm asking for your agreement that we follow through with a subpoena to get them.
No, I will not agree to subpoena anything. Let's see what happens.
But Mr. Chairman, you'll help me get them if they're available publicly?
Yes.
I appreciate that, Mr. Chairman. Mr. Kennedy, with all the questions here today, people just want to know the truth.
I don't think so.
Mr. Secretary, you don't think so. Thank you.
I don't think so.
I hope everyone recording that got that, because there explains the Secretary's tenure here. Look, 2 young ladies in Las Cruces, New Mexico, at a town hall recently gave me this starfish pin. I was going to give it to you today, but after your questioning today, I don't think you deserve it, because what this represents is to remember that every one of us can make a difference, sir, to something as small as a starfish on a beach that maybe got washed up, you throw it back in the ocean. You might not save them all, but you can save one. I'm sorry that you're not worthy of this nice little pin, sir, as a nice reminder. I'm going to pray for you, Secretary Kennedy. I hope we do better. I want you to do better, but today was a failure for you, man.
Less than a month ago, we received the heartbreaking news that a gunman opened fire at the CDC campus in Atlanta, Georgia. This obviously is my neck of the woods. This is heart-wrenching for all Americans, but for those of us especially who live in that area. A DeKalb County police officer, David Rose, was killed. The shots hit buildings on campus in at least 180 places, narrowly missing the CDC's daycare center. Law enforcement recovered nearly 500 shell casings. Clearly, he came to do a lot of damage. It's a miracle, and thanks to the quick action of Metro Atlanta and state law enforcement, more people were not killed. The Georgia Bureau of Investigation announced that prior to the attack, the gunman expressed discontent with the COVID vaccine and, quote, wanted to make the public aware of his distrust of the vaccines. Secretary Kennedy, I assume you are aware of these disturbing reports of the gunman's motives?
Yes.
And, I understand that some people may have concerns about new medical breakthroughs but those people don't have the world's top medical experts working under them. You've been over HHS for 7 months now. Have you ever been briefed by CDC's career immunization officials to discuss your concerns?
And by the way, every member of this panel has criticized President Trump and demonized him.
Have you ever
Are
been
you
briefed?
complicit in the assassination attempts on President Trump?
Sir, I'm asking the questions. You are the witness. It's a simple yes or no question. Have you ever been briefed by CDC's career immunization officials to discuss their concerns?
Yes, I have.
What was the answer?
Yes.
You have been briefed by CDC officials, the career immunization officials, to express your...
The senior vaccine safety scientist, for example.
Have you ever been to the CDC as secretary before the shooting on August 8th?
Have I ever been there as secretary?
Have you been there as secretary before the shooting?
No.
Okay. Let's return to the shooting and the aftermath. Secretary Kennedy, I'm about to ask you a series of yes or no questions about the events of the past month, and I would appreciate just a yes or no response. You called Dr. Manarez to your office on August 25th for a meeting. Is that correct? Yes or no?
It could be. I just don't know the date. I'd have to check my calendar.
Was Jim O'Neill the man you just appointed as acting director of CDC in the room on whatever date you met with him, since you can't recall? Was he in the room when you met with Dr. Manarez? In that meeting, did you criticize Dr. Manarez for her statements to CDC following the shooting where she said, quote, misinformation can be dangerous?
I don't believe so. I have no recollection.
You don't believe you criticized her?
Oh, I criticized her.
Did you criticize
Not
her?
for that.
Did you criticize her?
I don't even.
Did you criticize her for her statements to CDC workers following the shooting?
Did I what?
Did you demand that she fire career scientists or public experts at the CDC?
Yes.
Did you demand that she accept the recommendations of your hand-picked vaccine advisory panel without further review by career CDC scientists?
No, I did not.
You didn't ask for her commitment ahead of time that she would accept the recommendations from the advisory panel? You're denying that?
What I asked her about is she had made a statement that she was going to not sign on, and I wanted clarification about that.
Did you tell her to accept the advisory panel's recommendations?
I told her I didn't want her to have a rule that she's not going to sign on to it.
Did you say that the CDC was, quote, the most corrupt federal agency in the history of the world?
Not the history of the world, but definitely within HHS.
Did you say that?
I did not say that, but I did say it's the most corrupt agency at HHS, and maybe the government.
So you called the CDC corrupt. Did you say that CDC staff are, quote, horrible people?
Horrible people?
Did you say that they're killing children and they don't care?
No.
Okay, I think that we all have a history of listening to you and these answers, but you're on the record for a number of these statements. Despite your lack of credentials and expertise, clearly you have an agenda. It is a threat to the public health of the American people. It's clear that you are carrying out your extremist beliefs, which is why you attempted to fire Dr. Manarez.
We're the sickest people in the world.
Sir,
we're the sickest people on earth.
I'm speaking.
How am I a threat?
Secretary Kennedy, for the first time, we're seeing deaths from children from measles. We haven't seen that in 2 decades. We're seeing that under your watch. You are a hazard to the health of the American people.
Can I respond to that, Senator?
No, I claim back my time.
We need to wrap up.
You are a hazard to the health of the American people. I think that you ought to resign. And if you don't resign, the President of the United States, who put forward Operation Warp Speed, which worked, should fire you. Thank you so much.